Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with the educational videos about optimal health and the most innovative and holistic approach to your well-being. In this week's video, let's take a look at how you can heal kidney stones with natural and effective therapeutic tools. Passing a kidney stone can be a very painful experience, but just by this sometimes can put someone out of work or make it hard to go along the daily activities. Kidney stones are also the most common disorders of the urinary tract, and in this video I share with you great tips how to meet this situation in a more holistic way, so enjoy. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families, and don't forget to click that bell as it notifies you every time I upload a new video. And thank you so much for your thumbs ups and likes. And lastly, don't forget to have a look at my website, medicanova.net, at the online academy, where you will find comprehensive certified home study online courses in integrative medicine and health and wellness coaching. This video will be the last video of this year 2021, as I soon will take a well-deserved break over the holidays. Now, 2021 was quite a challenging and transformative year for me, and I'm sure for you too. Selling my property of 21 years and downsizing into a much smaller new home was quite an assignment in itself. Any new beginnings and life-transforming changes on such a huge scale evidently will bring up emotions, in particular fear and anxiety, because it's all unknown. We don't have the manual, we don't know where it's going. And the kidneys are very sensitive to these frequencies, and kidney infections or even kidney stones can present themselves during these times. So what are kidney stones? Well, kidney stones are called renal calculi, and they're small, they're hard deposits like stones that develop inside of your kidneys, made from materials you naturally always have present in your body, but in this case goes against you. And they can wind up blocking the normal flow of the urine, causing pain in your bladder as it swells, and the urine to become more abnormally concentrated with minerals as they accumulate and therefore can't be passed anymore. While most kidney stones will leave behind permanent damage, some may. And unresolved kidney stones therefore can develop into kidney damage or kidney failure, and it's very important you take care of that. So, otherwise you end up in an emergency room or even surgery. What are the symptoms? Of course, intense pain along with the kidneys on your side and back, maybe below the ribs. Pain can come and go. Maybe every 5 to 10 minutes. Of course, it can vary in intensity. Often the lower back is involved. That can spread down below the kidneys, even to your groin or even between your thighs. But mostly you can see a cloudy, bloody or foul-smelling urine. Discoloration of the urine. There may be brownish or pink colors in there. There may be little sediment like sands in there. Often there's a persistent urge to urinate than normal, but sometimes not much urine is actually coming out. Because the digestive system is so close to the urinary tract, there can be indigestion, maybe nausea and vomiting involved. Often fever and chills are present as well. Sometimes the stones won't be actually painful until they reach a certain size or start moving around the kidneys, and then you know you have a kidney stone. Now, who is most at risk? Well, I would say men, are most at risk, maybe middle-aged people, they say between 30 to 50 years old. White Americans, are more prone to kidney stones because I live in the US than African Americans. Anyone with a history of chronic urinary tract infections, of course. Also people who are affected with hyperthyroidism, I would say, or trouble digesting minerals normally. People who are more inactive, have a sedentary lifestyle, because the kidneys are there as an elimination organ. And so anything, waste products and water comes out of the kidneys. So if you don't move, that isn't working so well. So as already mentioned, kidney stones are made of clusters of minerals, acids and salts in the body that bind to one another inside the kidneys and becoming therefore lodged and sometimes blocking the urinary tract, giving you this intense pressure and pain especially when you try to go to the bathroom. About 80% of kidney stones are the type we know as calcium stones, which means calcium that's normally present in the body combines now with other substances to form this abnormally hard stone. While calcium stones are much more common, sometimes kidney stones are also caused by buildup maybe of other acidic salts like uric acid. So once a kidney forms stones, it can wind up attaching itself to sites that block the urinary tract, which is usually the primary reason for feeling then this intense pain. Sometimes the pain can subside and therefore it might seem, hey, kidney stone has gone, it's like, or it just has broken up, but that might not be the case. And it's really important here that you contact your professional healthcare practitioner to get a second opinion. So if you're interested in a health consultation, either for yourself and your children, contact me at Medica Nova at health@medicanova.net. Medica Nova is my practice for integrated and educational medicine. We offer a unique blend of natural and cutting-edge therapeutic tools from homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, and health and wellness coaching, and so much more. Book your appointment today. Let's go into the second part of this video, food for thought, or the metaphysical meaning. According to Chuck Martell's references, renal calculi are related to the kidneys, and it's the seat of fear, which I mentioned before. Often kidneys, really represent the seat of fear of the future, fear of money. Right? If you have financial problems, then the lower back starts to, seize up. It is the formations of stones or crystals from abundant quantities of salt, calcium, oxalates, and uric acid. Uric acid represents old emotions to be evacuated. And a calculus or stone can form in various parts of the urinary system. It is a mass of solidified energy created from aggressive thoughts, fears, emotions, and feelings about someone or a situation. As the kidneys are filters of emotions from the body's waste, the abundance of uric acid salts indicates the great quantity of solidified aggressive feelings, for they have been held in for a long time. As you know, we have a mind-body connection, and your stone also needed a frequency or a story to be created. It's not just because you maybe have too much calcium in your body or whatever. There's usually an emotional factor here. And he says, I have experienced frustrations and aggressive feelings in my relations for so long that my attention is now focused solely on that. Right? So everything becomes hardened in your body. My affective life is a failure, and I tell myself that happiness is only for others. Now, a balanced person has a solid back, right? But different character traits can cause calculi or the stones. In this case, I'm very authoritarian, often extremely hard on myself and on others. Meaning hard means something is hardened within your body. I make my decisions and choices reactively. I cling seriously to the past, and I lack willpower and self-confidence. I'm drastic in my opinions and choices. Renal calculi often involve an inner conflict between my resolve and my decisions that bring an excess of authoritarianism. Knowing that I'm weak and fearful, I mobilize all my available strengths in the same place in order to carry out certain tasks. And once the period of stress has passed, this concentration hardens to form a calculi. I repressed all my spontaneity, which has hardened again in order to live according to others. Everything is calculated, like the calculus, the name, and planned in advance to avoid surprises and gain a feeling of control over my life. There is therefore a me who has one of my personalities that live in society, and there is the other me who lives hidden in a closet and is made up of all the emotions I repress. My creative energies accumulate and my aggressiveness does so as well. All the unsaid thoughts that are clamoring to be released and express themselves are now transformed into renal calculi. I feel that I am being watched and that I must be on alert at all times. I tend to live in isolation, feeling guilty or unable to communicate. I forbid myself to do many things. I allow others to invade me or to invade my life, and I can't demarcate what belongs to me. Demarcate is almost like you use your urine like a dog, to demarcate your area. Because there's nothing coming out. Often you have the urge, but you can't urinate. So what would be the positive affirmation? I accept to recover some inner peace if I want to stop having calculi. I should brood less on certain conflicted situations and certain problems, for in so doing, I prevent myself from moving forward. I must resolve them definitely and view the future calmly and flexibly. It is a matter of awareness and attitude. What is your relationship to the situation? I live spontaneously, like a child, and my life is filled with happiness and surprises. I know it's not easily, we can say, well, there's always the story which creates the renal stone in this case. But there is, in my practice as a healthcare practitioner over so many decades now, very rarely can I say it's just a physical symptomatology. Usually there is a certain mental, emotional stress behind the expression of these symptoms, which caused it. It was maybe dormant inside you, or it was a genetic layer, but it needs a trigger to come up to the surface. And often it's a mental, emotional aspect here. If you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths qualities in achieving the very best of you, then contact Medica Nova Wellness Coaching at health@medicanova.net for your 3 months coaching program. I am coaching you to be well. Let's move on to the natural treatments now. Well, with kidney or any urinary tract infections or ailments, you need to drink more water, stay hydrated. You need to really activate the kidneys to flush out whatever toxins you are carrying. Especially if you exercise a lot, you live in a hot climate like I do here. We have sun all over. It's really hard to make a video because the sun blares your face all the time. Drink diuretic beverages and sweat a lot. All that, really calls for more water. Also, you have to have a nutrient-dense diet. Right? It's like if you're low on nutrients, electrolytes, antioxidants, you have more the risk, to develop kidney stones, particularly eating a very salty or high protein diet. The actual, sort of ratio of protein a day should be only 30% in your diet, but if you eat more, it can result in more ammonia in your urine and therefore uric acid. And kidney stones also, your diet should be rich more in vitamin E food, magnesium, potassium, zinc, all the goodies. Just a note here, while vitamin C, has numerous benefits, particularly during this time now with the pandemic and, boosting up your immune system, too much of vitamin C actually can worsen your kidney stones, as well as calcium or even antacid supplements. avoid caffeine and alcohol, because it's difficult to digest and of course make the kidney stones work. Get regular exercise. Again, the kidneys are detoxification, elimination organ, and if you just don't move around, the calcium cannot be released into the blood, which of course increases the risk again. Externally, I really like castor oil packs. You can go in your health food store and get yourself a bottle of castor oil. It relieves the pain quite immediately, particularly the cramping and the muscle spasm in the abdomen. So you can get yourself a bottle, soak up a flannel with the oil. I know it's a bit messy, put it on the affected area, maybe put some plastic around or a good towel, and pad it up with a hot water bottle and just lie there for 20 minutes, and it's really effective. I also would bring in some supplements in general, just to sort of support the kidney system here. Magnesium is here very helpful. I would say 250 milligrams twice a day, as well as vitamin Bs. The complex here, because it reduces the calcium and the oxalates from accumulating in the body too much, especially vitamin B6 here. You want to bring in an antioxidant supplement or multivitamin, particularly when it contains vitamin E. It lowers the inflammatory aspect, reducing again the calcium and the oxalate buildup. I would say 400 IUs of the vitamin E daily would be good. Cranberry herbal extract is wonderful. It reduces the risk of developing urinary tract infections in the first place and balances the calcium level. 400 milligrams twice a day, and if it's really acute, maybe bring in some aloe vera gel, mix it up with a glass of warm water and drink it. It cools down the body and reduces this crystallization of the minerals in the urinary tract. I want to finish this video with my favorite part. It's called Homeopathic Remedies. The reason is I want to bring in these remedies because they really individually target your specific key symptoms. So it's not just a one-size-fits-all remedy, because sometimes you have the kidney stone on the left side or on the right side, or the main symptom is a burning sensation, or it comes up with a sediment, right? So you want to really target your individual story, and homeopathy can do that. Although kidney stones are considered, of course, a case of surgery under the conventional mode of medicine, natural medicines can break down and therefore dissolve also kidney stones, depending on the size. Of course, if it's a small kidney stone, then it's easier without the surgical intervention. And I would say, why not try this first? And in this video, I want to cover really only the remedies you can have access to in your local health food store, as well as online. So it's nothing too complicated. If you have any questions, or you're not quite sure about how to take the remedy, of course, contact your healthcare practitioner or contact my practice, Medica Nova, at health@medicanova.net. I'm happy to help and to book in your appointment. Now, the dosage plan for adults in an acute stage, I would say the potency 30, 1 tablet every 1 to 2 hours till improvement sets in. Stop taking any further remedies then, but of course for maintenance protocol, I would say contact my practice, Medica Nova, at health@medicanova.net, and I give you further guidelines. So if you have a kidney stone on the left side, the remedy is called Berberis vulgaris 30. You will get it in your health food store. It's one of the top list remedy here for kidney stones formed on the left side. And the unique symptom guiding Berberis vulgaris is the pain in the left kidney, which radiates down also the urethra and into the urinary bladder. So if it's on the left side, think about Berberis vulgaris 30. The pain can be quite shooting, cutting even, or stinging in nature. It also worsens more on motion or jarring movements. The urine may be yellow and maybe contains even a slimy sediment. You can see that in the toilet bowl. And the kidney region is very sensitive to touch, even when you put your hand on it. On the other side, if you have a kidney stone which is located on the right-hand side of your body, then it's Lycopodium clavatum 30. Wonderful remedy here. Again, the pain worsens before urination often. The urine is quite scanty and the kidney pain subsides after passing urine. There can be red sediments may appear in the urine, can be even red little sand, things like that. And in some cases, the urine may be even purulent, there may be pus involved, but it can be also turbid and pale. If you see white sand or yellow sand in your urine, you then choose the remedy Hydrangea arborescens 30. It's actually called the stone breaker because Hydrangea arborescens is used to crush kidney stones. Fantastic remedy here. Stones in the ureter as well as in the bladder. And the significant symptoms is here to look out for these white deposits or the yellow sand in the urine. Of course, soreness in the region may be felt. Sometimes there can be blood, but it's very specific with the sediments. If you have kidney stone, where the main keynote is a burning sensation on urination, you then choose the remedy Cantharis vesicatoria 30. It's also a fantastic remedy for any UTI infections where you have this burning sensation. And especially when you pass the urine. The burning may also be present before the urine is passed or may continue after the urination even. There's definitely kidney pain and this frequent urge to pass the urine. We call it tenesmus of the bladder, where you have this feeling you constantly need to go to the toilet, but not a lot is coming out, right? And that just often drives you crazy. It's an unsatisfactory urination, we call it. There may be also some jelly-like mucus involved. Now, if you have kidney stones with this burning sensation at the close of the urination only, so not just before or during, but at the close of the urination, the remedy is called Barilla officinalis 30. It's beautiful remedy indicated for the specific keynote here. The urine is passed quite scanty again. There may be slimy or sandy particles seen in the urine, and it can be also prescribed for right-sided kidney stones like Lycopodium clavatum as well. So of course homeopathy offers many more remedies indicated for kidney stones. For example, we have Oxinum, Canum, Tabacum or Parrea brava. But I want to keep it simple here. And I also want to talk just about the remedies you have access to, right, in your local health food store and online. And of course, if it gets more difficult, contact your professional homeopath. So I hope that today's video has inspired you to seek to heal your kidney stones from the inside out. And here I'm talking about addressing your mental, emotional, as well as your physical aspects. So if you have any questions about the treatment protocols or need more guidelines, contact my practice Medica Nova at health@medicanova.net, and also have a look at my website medicanova.net at the online academy for your comprehensive certified home study online courses in integrated medicine and health and wellness coaching. To all my subscribers and friends of Medica Nova Wellness Studio, I thank you dearly for being part of this community during the whole year of 2021, and may you continue to blossom and thrive with optimal and vibrant health. I wish you all a wonderful new year, 2020. Till next time, much love.